Rick's Corner, I have Dr. Mark Braunstein back. He's been very popular on my show and talks a lot about the ailments and medical conditions that we use every day in life, in and out of the gym. And today we're going to talk about depression, right?
Right.
Now, you said there's two types. There's bipolar and unipolar?
That's correct.
Okay, how does that work?
Well, I thought it would be an appropriate topic, first of all, because this time of the year, that's about one of the most common things we see in medicine. And people come in, the holidays, Thanksgiving, the Jewish holidays, Rosh Hashanah, Yom Kippur, etc.
Yeah.
And then Christmas, they all elicit, and New Year's all elicit feelings in all of us. Maybe previous relationships, we're not seeing our family, we are seeing it.
Yeah,
it's a very stressful time too, getting together and reestablishing relationships with people we don't normally see.
Right.
So a lot of people get stressed out and have mood swings this time of year. In terms of depression, that's the most common disease I see. And I've been treating that for 25 years. I don't do psychotherapy, but I do diagnose it and treat it and refer people to a therapist when needed. Mostly people come in with sadness, not wanting to do something, loss of interest, isolating themselves from normal behaviors. They have loss of energy, they can't get out of bed, don't take a shower, don't get dressed. And I'm sure a lot of you are out there ticking off all these symptoms. It's a matter of degree. If it disables you, that's what pretty much differentiates sadness from depression clinically. Someone that can't go to work, they
just
really
can't function.
Cannot function.
Yeah. How do you treat that?
So the first thing is it's like anything else in all of medicine and in life in a way, to divide it into categories. The two big categories are bipolar depression,
right,
which is 40%. It's a lot.
Yeah.
Totally different disease than what we normally think of as depression. So 4 out of 10 bipolar depression. This is in a medical practice. 6 out of 10 unipolar, which is major depression, which is what we all think of as depression. Bipolar depression is a much more serious illness, although it can be treated very successfully. It starts off usually in childhood with a very anxious childhood. And if you interview the parents of an adult, if you can get them to come in, or friends of an adult, they'll often describe the person as having had a lot of isolating behaviors, a little different as a kid, a little more emotional, moody, and especially anxious and guilt-ridden, maybe is the best way to describe it. And maybe had periods where they'd stay in their room for a couple of weeks, so more or less, and not play with their friends, more so than the average kid.
Okay. How do you treat that?
So now, coming to the present time, if you suspect bipolar disorder, you do not give antidepressants. That's one of the biggest mistakes made in all of medicine and psychiatry. So 80% of patients with bipolar depression will get worse with antidepressants. 20% get better and no one knows why.
Really?
So if they're bad enough, if they're sick enough, by the time they see me, usually that's the case, they need more than just a friend to talk to. They need more than just a therapist. The main thing is giving mood stabilizers instead of antidepressants, and making that distinction between bipolar depression and major depression is a huge part of medicine. People with major depression can do well with just therapy sometimes. Bipolar disorder, you often always need medication, in my opinion, always, and probably for life.
Really?
And it may take months or years to find the right combinations of medicines. Unipolar depression can get better with 1 or 2 medications, antidepressants like Prozac, Lexapro, Zoloft, Celexa, etc. And those you may be able to stop after 6 to 12 months or 18 months. The brain actually heals partially with time. There's brain damage that occurs with depression, so it's really a neurological disorder. And luckily the brain can heal. So if you can get someone to feeling almost entirely better, or to the point they feel normal again, they can actually heal from this disease.
Well, I talk to people that tell me, oh, I'm so depressed today, but it's like a short-term depression. It's not really a sickness. Or I'm depressed because something didn't happen. I know in my life, and I'm sure with a lot of people, when I get up in the morning, there's no one here. I eat my breakfast, and I could very well say, okay, I'm going to stay in bed. I don't feel like going out. But when I go to the gym, because I mentioned that before, and I work out, everything opens up, and I feel 100% better. I'm mixing with people, I'm talking, I'm working out, the blood's flowing, I get the energy level going, and anything that would be a depression is gone just because of that.
That's a good point. So exercise, as Rick pointed out, is one of the most effective tools in treating bipolar and unipolar depression. It's also important to remember that sadness, the disease of depression, is not the disease of sadness. There are people that have depression that aren't even sad.
Right.
But they stop getting out of bed, they stop eating, they lose their appetite, they lose their willpower to do things. And it's a very serious disease, but easily treated once it's identified. Exercise being crucial, restoring sleep, paramount. In fact, restoring sleep, a normal sleep pattern, is probably one of the earliest treatment goals in treating all depression.
Well, you have to have a purpose. I mean, when you get up in the morning, if you have no purpose, I have friends like that. They get up and they stay in the house all day, and I can see they're depressed. They have nowhere to go, nothing to do.
Right.
And I told one of them, I said, you need to lose weight, you need to get in shape, join a gym, get out of the house. It's like going to work. You see the same people every day, you get a rapport of friends, you get some exercise and blood flowing, and it'll lighten your whole day. And he tried it. He says, you're right. He says, I just have to commit every day to do it. You just don't do it one day and then take off 2 weeks.
That's right.
And it's not a matter of building the body, it's a matter of opening the mind. Right?
Right. And so the depression I'm talking about is once they've tried all those things already, that's who comes to me. But I have to be careful not to overtreat the person, that all they need is someone like Rick to give them, to motivate them, to get them out of a rut.
Yeah.
Where they really, all they do need is someone like a friend or a coach or someone to get them to work out, to get them to socialize,
get
to drag them to a party.
Exactly.
Yeah. The ones that aren't draggable to a party are the ones that I see.
Yeah.
And a difference. So but it is the most common problem seen in medical practices of adults today in America.
Now I have another question. Are we still on this topic? Because I have something that leads away from that.
Not necessarily.
All right, depression is one thing. What about anxiety and panic attacks? Because that can depress you too. It can make you feel like you're having a heart attack.
Yes, well, I have personal experience with panic attacks.
So do I. That's why I'm asking.
Yeah, I suffered from those when I was in medical school, my second year.
Yeah.
They're genetic. It's a neurobiological disorder. So you don't need to have a bad childhood or a history of childhood trauma.
Okay.
Or even necessarily an extensive psychiatric history of diseases in your family. But typically it starts with in the late teens, early 20s, and peaks around the mid-20s with an exaggerated, overwhelming surges of anxiety. And the way I described it to people when I had panic. Well, what did it feel like when you
Well, I'll tell you, I think I know where it started. I was around 12 years old, and I used to go to the wrestling matches with my dad. So he'd come home and run wrestle in the living room with me just to play, and he'd sit on me against the couch, and I couldn't breathe. I started to panic. I said, I can't move and I can't breathe, because I was out of control. I didn't have control. And then as I got older and I started flying around the country to do some wrestling, I got into an airplane. Maybe many of you felt this way. When they shut that door, you feel like you have no oxygen. It's like, I can't breathe. I'm in a tube and I can't breathe. I started to panic. You break out into sweat, your heart starts beating fast, you flush, and you feel like you're having a heart attack. You have to really talk yourself down, take a couple deep breaths. Then when I would get in a car with somebody, I cannot go in the back seat, especially a two-door with no door, because there's no escape route, right? And on the freeway, I was with my girlfriend last year, and we were in this lane that's just bumper to bumper. I had to move over to that lane. I was starting to panic. I loosened my shirt, took the seatbelt out, rolled the window down, put the air conditioning. I said, what's wrong? I said, I'm having anxiety. I can't stand to be enclosed in something. So it went from that to that to that, and then elevators were like, forget that. I got locked in one once, and that was horrible. I got locked in the bathroom with my son at a shopping mall downstairs, and it was a metal door. He never saw this. He said, I can't believe you did that. You took the whole metal door and the thing and turned it around and ripped the whole metal door off because I wanted out of there.
Yeah.
So those are the things that have happened, but I thought maybe I'm right or wrong, but I said, I got to face my fears. I got to face them. So I started using
desensitization therapy.
I started going to more elevators with people and just waiting for it to open, and it opens, and I said, okay, I'm fine. I'm okay now. Sitting in cars now, and the passenger side used to bug me, now I can do it. The biggest thing, and I'm not afraid of flying. It doesn't bother me. It's getting through to the airplane and getting up in the air, and then the door shutting kind of used to bother me. But now we flew back east, and we had business class seats, which are more room. And when they shut the door and I was talking and they put a movie and I got there and came back and there was no fear at all. So I feel like I've conquered all three of those things now.
Yeah, and the anxiety disorders tend to get better as we get older. So they tend to peak in their 20s and 30s, early 30s, late teens, and improve with time. They're easily treated. It's one of the easiest things to treat in medicine. There's no reason anyone should be suffering with panic disorder or anxiety disorder. Untreated panic disorder leads to avoiding situations that cause anxiety or that we associate with anxiety. And then pretty soon you're limiting your whole life to the very few activities that you think don't, which is agoraphobia.
Agoraphobia, exactly.
The fear of leaving the home, but it's really the fear of being, say, in the movie theater in the middle row, in the middle seat,
can't do that.
And you can't get out, or the feeling of being trapped in the little car, the airplane. And the most common symptom of a panic attack is wanting to leave where you are.
Right now,
as soon as you feel better, as soon as you leave where you are, thus the person may risk their life to get out of a situation which isn't dangerous and put themselves in a more dangerous position.
I went to a play once. It was a chorus line in Hollywood, and this is a long time ago, my first marriage, and I had seats right in the middle, which I do not want to sit. I need to sit on the aisle because my knees hurt. Put me in the middle. I see this whole aisle's clear, this is clear. All of a sudden it fills up with all these big heavy women around me. And then they tell me you can't leave for the first 15 minutes of the show. You have to sit there. And then I got thirsty. So I put a mint in my mouth and it popped it and it got stuck in my throat. And I said, oh my God, I got to get out of this seat. I need water now because I panicked.
Right. And the thing to remember too is nobody ever died of a panic attack. Really, you may see in the movies, but no one dies from anxiety. What helps is exercise.
Yeah.
Desensitization therapy, where you expose yourself to gradually more and more anxiety evoking events, and you learn to relax your body as you picture yourself in these different scenarios. And you can do that with a psychotherapist. There are workbooks, anxiety workbooks that take you through that process. Tapes, well, they're not tapes anymore. You can download an app on your iPhone for that. Relaxation therapy is paramount. Psychotherapy, individual therapy, not necessarily with a psychiatrist. Then there's medications that block them very easily, which is where I come in. One of the easiest things to treat. It's a miracle people are better in a day. They think you're God just because it's such a miserable, horrible thing to have that much anxiety.
Yeah, it is.
It ruins your life. And
how do you treat it
easily
medically?
treated? Well, a lot of the antidepressants in very, very tiny doses help dramatically by suppressing and blocking these panic attacks. Then there's benzodiazepines for breakthrough anxiety, such as low doses of Valium, Klonopin, Xanax, although they can be addictive. And then there's some other medicines too you can use, but that have more side effects. But sometimes it takes a combination, and often panic disorder can coexist with depression or post-traumatic stress disorder, and has a certain high correlation with attention deficit disorder, ADD or ADHD, attention deficit with hyperactivity. So there's clusters of these things, but they often all respond to one. You focus your treatment on the worst symptoms, and then you go to the next worst and the next worst, and they all respond to similar medications.
I was told on the plane, find something to touch that's familiar, like home. Talk to somebody, drink some water, and feel things that would be around you normally.
Yes.
And if you're in a hotel room and you've got your laptop or you've got something that you're used to using, it takes all that away. Also, there's an over-the-counter medication called Rescue Remedy. It's just 3 little drops under your tongue. It's homeopathic, and it supposedly gets rid of the feeling of it. So,
I don't know.
Well, I got some before I went to Delaware, and I took it because I thought, well, maybe it'll happen, maybe it won't. but nothing ever came about. So maybe it worked, and maybe it didn't. But I kind of like protected myself by taking it.
Yeah, and also most psychologists, psychiatrists, therapists would want you to get a medical examination. There are some medical disorders, they're not very common, that can mimic or have depression as one of their symptoms.
Yeah.
A rare one would be pancreatic cancer. That's one of the most almost universal earliest symptom of pancreatic cancer can be depression. But then you start the weight loss, the abdominal pain, but disorders of certain hormones, low thyroid, high thyroid, electrolytes. There's all these different disorders. Brain tumors are rare, but sometimes people rarely need an MRI of the brain.
Well, I had a couple guys on yesterday that are lift trainers and lifters. We were talking about thyroid because both of them, or one of them told me he took a test and his thyroid was low. He never knew it was low.
Yeah.
So he took some, and you had me on some as well, and he said his energy level just went right up.
Yeah, very common. The most common is not to have a coexisting medical disorder, although low testosterone in men 30 and over is, in my opinion, highly correlated and caused by depression. So treating hypogonadism, which we talked about in an earlier episode, and other guests have discussed, that can be quite effective in men. I've taken at least 2 or 3 patients off of their antidepressants they came to me on.
Yeah.
And substituted testosterone, they did better than ever. They felt fine. And they really just had hypogonadism.
That makes a lot of sense. What about HCG?
HCG, I can think of one patient offhand who'd suffered lifelong treatment-resistant depression who responded dramatically to HCG, very low dose, daily subcutaneous injections of human growth hormone, which is HGH.
Well, HGH, but HCG is
HGH. Now, HCG
comes from a pregnant woman's urine.
Yeah, that's different. HGH definitely I've seen help with depression, although it's not a traditional treatment. HCG mimics luteinizing hormone, and it can in effect raise your testosterone levels.
Right.
So it's been, I think, more common in the sports field where people have used the HCG, but people do use it.
Yeah, well, the reason I even bring it up because a lot of the viewers out testosterone go off a cycle and they do HCG to bring their testosterone back normally. They're going in.
Right.
And so that's what it was used for in that world. However, it's also used in fat clinics to reduce body fat.
That's right. In California, there had been, I'm not sure if there still is, a shortage of generic HCG. So the people that have come to me that wanted these shots are subcutaneous shots done with an insulin syringe once or twice a week.
Yeah.
The only companies that made the non-generic, which is thousands of dollars a month.
Thousands of dollars, yeah.
Instead of tens of dollars a month for the generic.
Well, there's also a lot of phony stuff around. There's a lot on the black market with you guys and the bodybuilders. You know, you buy it from a guy at the gym. He's got the GH. He sells it for like $300 or $600, but it's not real.
Or it may have a very tiny amount.
Yeah,
maybe a real drug in it, but it's it's always better to get the prescription version.
Same thing with testosterone. You buy it, and these guys are making their own labs and making their stuff. Sometimes they say it's like 500 milligrams a cc, which just seems awfully a lot for that.
It's a lot.
It's a lot. I don't even know how you get it through the needle. Well, that's been very enlightening, Doctor. This is something that maybe all of you have had in your past, or many of you, with the depression, with the bipolar, with the anxiety and panic attacks. I talk to a lot of people that have anxiety, a lot of people, and there's ways around it.
And I would just emphasize this more than I can even almost do. Depression is a completely treatable disorder. There's no reason to be suffering from depression or suicidality or any of those feelings. They are treatable. Go see your doctor.
Okay, and your website is?
Well, my website is my new website that my son created, I believe, is www.drmarkbraunstein.md.
Okay, I'm going to find it and put it up so you guys can see it.
Sherman Oaks.
The doctor's right by me, right down the street. And what I like about you, I've sent you a few people recently.
Thank you.
They must have told you.
They did.
Okay. And so I had texted you one day. This is how good this doctor is. And I said, my back's hurting on the left side. I only have one kidney. And I said, I hope it's not my kidney. So he says to me, come right over. I'll give you a urine test. Like that. How often do you have to wait weeks to get in to see a doctor? While I was there, they tested right then. And results came back. I was okay. So I felt good and I went to lunch.
Good.
But it was nice of you to do that, and this is the way you treat your patients, and this is what they like.
Yes, well, that's my style.
It's a great style to have.
Thank you.
So thank you for being here.
Thank you.
And it's always been a pleasure.
Yeah, everybody have a happy holiday out there.
Thank you. You guys have a happy holiday. Stay tuned for more Rick's Corner. We'll have the doctor back again for more subjects. If you have anything you'd like him to talk about, email me or put it on my comments, and we'll bring it back and talk about it. And we'll see you next time. Have a good holiday.
Drasin.com. He is the equalizer, baby. See you next time.